Hello, and welcome to Know the Risks, a parent's guide to e-cigarettes and youth. This presentation was created by the Centers for Disease Control and Prevention, National Center for Chronic Disease Prevention and Health Promotion, Office on Smoking and Health. This presentation is being delivered by Carolyn Wilson, GASP Coordinator. E-cigarettes are sometimes called e-cigs, vapes, and electronic nicotine delivery systems, or ENDS. They're battery-operated devices that heat a liquid to produce an inhaled aerosol. The liquid in e-cigarettes usually contains nicotine, as well as flavorings and other chemicals. Some e-cigarettes can be used to deliver THC, a psychoactive chemical found in cannabis or other drugs. E-cigarettes come in a variety of shapes and sizes. Some e-cigarettes look like USB flash drives or regular cigarettes. In 2022, the most common type of device used by middle and high school students was disposable e-cigarettes. It's important to note that tobacco use is not safe for young people. The CDC and the Food and Drug Administration analyzed data from the 2022 National Youth Tobacco Survey to estimate current past 30-day use of 8 tobacco products among US middle and high school students. Since 2014, e-cigarettes have been the most commonly used tobacco product among US youth. In 2022, e-cigarettes continue to be the most common tobacco product. Over 2.5 million students currently used e-cigarettes in 2022, including 2.14 million high school students. Among both middle and high school students who currently used e-cigarettes, the most commonly used device was disposables, followed by pre-filled or refillable pods or cartridges, and tanks or mod systems. The most commonly reported usual brand was Puff Bar, followed by Views, Juul, Smoke, Enjoy, Hyde, and Blue. Approximately 1/5 of current e-cigarette users reported some other brand as their usual brand. Nicotine exposure during adolescence can harm the developing brain, which continues to develop until around age 25. Using nicotine in adolescence can harm the parts of the brain that control attention, learning, mood, and impulse control. Using nicotine in adolescence may also increase risk for future addiction to other drugs. When a person is dependent on nicotine and stops using it, their body and brain must readjust to not having nicotine. Youth may turn to vaping to try to deal with stress or anxiety, creating a cycle of nicotine dependence. Nicotine withdrawal symptoms include irritability, restlessness, feeling anxious or depressed, trouble sleeping, problems concentrating, and craving nicotine. People, especially youth, may keep using tobacco products to help relieve these symptoms. Besides nicotine, e-cigarette aerosol can contain cancer-causing chemicals, heavy metals, and ultrafine particles that can be inhaled deeply into the lungs and harm your body. Again, it is not harmless and it is not water vapor. And even though e-cigarette aerosol generally contains fewer harmful chemicals than regular cigarettes, safer doesn't mean safe. This applies to both people using e-cigarettes as well as people who may be exposed to secondhand aerosol from other people using e-cigarettes. And those flavorings in e-cigarettes aren't necessarily safe either. The gut can handle a lot more than the lungs, and flavorings in e-liquids or pods may not be safe when inhaled. Scientists are still working to understand more fully the health effects and harmful doses of e-cigarette content when they are heated and turned into aerosol. Youth trying an e-cigarette means the first use of the product. Here, you can see youth reasons for ever trying an e-cigarette. The most popular reason was a friend uses or used them. Second was curious. Third, feeling anxious, stressed, or depressed. And lastly, to get high or a buzz from nicotine. Current use of e-cigarettes was defined as use of one or more days during the past 30 days. Youth exposure to e-cigarettes is increasing. And these messages come in many different forms, whether it's store signs, television ads, movies, the internet, social media ads, magazines with cool images, or newspapers. It's all around you. The tobacco industry is one of the main contributors. They spend billions of dollars every year marketing their products. E-cigarette ads reach nearly 4 in 5 middle school and high school students, and tobacco product advertising reaches 3 in 4 middle and high school students. The tobacco companies specifically advertise and market their products to specific populations. Tobacco ads make smoking appear to be appealing, which can increase adolescents' desire to smoke. Marketing towards women is dominating by themes of social desirability, empowerment, and independence, which are conveyed by advertisements featuring slim, attractive, and athletic models. Hispanic, American Indian, or Alaska Natives, African Americans can be targeted with advertisements and promotion for menthol cigarettes. The number of retailers selling tobacco products varies widely depending on the community characteristics, with more retailers in areas in lower incomes and greater proportions of African American residents. E-cigarettes in youth-appealing flavors are being sold in retailers, Several of the e-cigarettes most popular with youth resemble flash drives and can be relatively odorless. E-cigarettes can be stealth products and disguised as backpacks, smartwatches, sweatshirts, fidget spinners, handheld gaming devices, or other things. There are policies that we know work and have known that they work for decades, but have not been implemented in all communities. These may include increasing the price of tobacco products, smoke-free indoor air laws, and prohibiting the sale of flavored products. It is never too late to talk with your teen about e-cigarettes. Educate yourself about e-cigarettes before discussing them with your teen and learn helpful ways to approach the conversation. Recognize the warning signs of nicotine addiction in youth and find e-cigarette quit resources tailored to teens. It's important to keep the conversation going. The Surgeon General's website contains additional tools and resources for parents regarding youth use of e-cigarettes. Most youth want to quit vaping or using e-cigarettes, and here are ways to help them quit. These are several different resources, including quit lines, texting programs, web and phone-based resources. And lastly, policy is important. Please familiarize yourself with your child's school policies. Talk to your child about the rules, guidelines, and any other expectations you may have. You may want to set some other guidelines as well, such as tobacco and vape-free homes and cars. Consider supporting local smoke or vape-free policies. For additional information, please visit the CDC website to find quick facts on the risks of e-cigarettes for kids, teens, and young adults. This concludes this presentation. Thank you for your attention.